I'm Kiki. Welcome to Couch Convo. My purpose in life is to help people feel informed, capable, and empowered in their own bodies through movement, education, and realistic health guidance. I am here today with Dr. Anninda Monte, a pelvic floor health therapist, and I have the pleasure of working with this wonderful woman. So we're about to have a conversation about the pelvic floor. Be ready to listen. So, how long have you been working in the industry of pelvic floor health as a physical therapist?
So I've been a practicing physical therapist for about 34 years and doing primarily pelvic health for about 19 years.
Okay. So that's a long time.
Yeah.
What brings you joy about working with patients in the pelvic floor health realm?
Wow. So what brings me joy is the majority of my patients, I do see both men and women, but the majority are females.
Mm-hmm.
And I think it's something with working with females, there's a general sisterhood and connection right away. And I feel like for the majority of maybe healthcare, that women have always gotten the short end of the stick when it comes to information and options for their body and choices that they can make about their body.
Right.
So I think with pelvic health rehab, we get down to the nitty and gritty. I mean, a lot of women will get referred to me for maybe some pelvic pain symptoms, and the doctors will usually write pelvic pain, unable to have sex. But sometimes we do address the pelvic pain, but sometimes the women really don't want to have sex. That's their choice.
That's their choice. Yes, that's absolutely right. That's absolutely right. So we're talking about pelvic floor. Can you tell us what the pelvic floor is? What exactly is it?
Well, the pelvic floor is a group of muscle structures. I mean, without getting too anatomically technical, if you think about like a cylindrical device, and the bottom portion where it's open, the pelvic floor acts as a taut trampoline to hold pretty much all the abdominal contents.
Oh, wow.
Usually in some literature, they'll describe it as a basket, a bowl, or even a hammock.
I've heard hammock several times, but hammocks sink.
But yes, so all of those, they sink.
Yeah.
If you have a good functioning pelvic floor, it is the foundation of your basement. If you are sinking in your basement, you're going to have some cracks. You're going to have some leaks. You're going to have some instability.
Yeah.
Right?
Yeah.
So those things, same with the pelvic floor. So we want a taut trampoline. Primarily, if you come to see somebody like me because of pelvic floor dysfunction, we're looking primarily at any bladder issues, any bowel issues, and any, again, sexual dysfunction.
Sexual dysfunction, bowel issues. Pelvic floor is also comprised of the core, correct?
Oh, absolutely.
Can you explain how that is?
Well, so everybody back in the 70s, 80s, 90s, 2000s, they all talked about the transverse abdominals, right?
Yep.
That deep,
our girdle.
Yes, our deep girdle. But all they did was talk about the transverse abdominals and just engage that. So it is important, but it's only the basics. The transverse abdominals, we know, work with the pelvic floor muscles. Even though there are different in this location, you cannot contract the transverse muscle without contracting the pelvic floor. If you contract the pelvic floor, you are also engaging your transverse abdominals. Now, what we have learned, because we're more knowledgeable, is we teach patients to do more of an abdominal bracing. We have all these big muscles here. Why would we not use them?
Why not use them?
Yeah, we have these side muscles here. Why would we not use them?
Right.
Then we have the back muscles. Yeah. We should be using all those muscles to be more efficient in our movement.
Yeah, you talked about abdominal brace and our girdle. And I usually tell patients, like, that's the girdle that the good Lord gave us that we don't use. Like, we have one.
Yeah.
We have a girdle, corset, whatever you want to call it, Spanx, but we have it.
It is our biological Spanx.
I love it.
Biological Spanx. So much more cheaper.
This is true. Instead of making reoccurring trips to like JCPenney or somebody.
Yeah.
But yeah, so with that in pelvic floor, you name that it could be, it's our core, it's our back. You know, core is also comprised of posture. Posture is another way.
Absolutely.
I've hearing that diaphragmatic breathing also helps strengthen, you know, the pelvic floor and the
Right.
core muscles, and it also helps with bladder control and function. And you also mentioned sexual health in there. So how can having a strong pelvic floor help with sexual health?
Well, there is a strong correlation with how optimized you can use your pelvic floor, meaning you can grab and lift, with having vaginal orgasms. So two kinds of orgasms. So there's clitoral orgasms, and some people, you know, those are good, but the majority of women can have clitoral orgasms. Only 20% of able-bodied women walking around can actually have vaginal orgasms. Most women don't even know where their G-spot is.
All right.
So we know if we are having heterosexual intercourse, the head of the penis has the majority of sensory nerves, right? And so the liken to that for females is kind of like the clitoris in the back. But guess what also has a lot of sensation? The testicles.
True.
Right?
Very true. Very true.
So for females, the testicle portion is behind the clitoris on the inside. So it's only an inch to an inch and a half in the vaginal vault. So in the vaginal vault towards the front, if you stick a finger up there, it's right behind the clitoris on the
Almost
inside.
Like a J.
Yes.
I know y'all have heard of J before.
Yeah,
we'll leave that at that.
Well, that is up for a different conversation that we can have in May.
Ooh, can't wait.
But it is there where you have your G-spot. It's very sensitive. If you use your pelvic floor muscles, I mean, back in the day we call them Kegels, but pelvic floor contractions with a strong contraction, but an efficient release, because you have to be able to lengthen the muscle. You optimize blood flow and circulation to that area, and that helps with excitability and orgasms.
Yes. Woo, orgasms. I know that some women, you said earlier that some women don't want to have sex because of having pain. So could you break down some of the symptoms that represents having pelvic floor dysfunction?
Oh, as far as pain. So when we chat with women, we ask them when they are having pain in the pelvis, we first have to clear whether it's an orthopedic issue, right? Because it could be kind of back, hip, those things. But then when they say, and when we ask very specifically, do they have pain with intercourse at penetration or deep thrusting? Usually women know right away. A lot of women will have pain at penetration where it's very hypersensitive and irritable. It could be varying types of agitators reported. They will say it feels like it's tearing. It feels like it's nervy pain. Some women will say it feels like sandpaper, and that could be related to hormonal changes and dryness. Some people will say that it feels like an ache. Could there be old scar tissue, maybe from delivery, or even like from trauma, or even from surgical trauma? It could be any of those things. So it's like any part of our body, we would desensitize that area at penetration. So opening of the vagina is what we call the introital ring. Right. So we would desensitize those areas so penetration would become easier. Right. If women are anxious and they're anticipating pain, they may not even self-lubricate. Okay. And that could add additional problems. Right.
So you mentioned about self-lubricating. Does menopause affect pelvic floor?
Absolutely, for many women. Every woman is different and they have their own history and story. But as our estrogen levels deplete, and if there is any surgical interventions to the cervix, the upper 1/3 of the vaginal vault, to include the cervix, is responsible for self-lubrication. Okay. So women who have had hysterectomies, and if that is removed, they may potentially have some drying issues. If a woman has a depletion of estrogen, you know, it's high, it's low, it's medium, they will have maybe some irritation and drying. And so some women will say that with deep thrusting, that their labia sticks to the shaft of the penis.
Oh, goodness.
And it's irritating.
Yeah.
And some women will even say the clitoris becomes sensitive.
Okay.
So where back in the day, whether they liked it orally stimulated or digitally stimulated, now they're like, oh, please don't touch that.
Okay.
Because it's irritating. Another thing is the urethra. You know, a lot of times we don't talk about that.
Right.
Is with estrogen depletes, it can also become irritating where you feel the urge to go because it's dry and you know there's something wrong. A lot of women will race to their doctors thinking they have a UTI.
Right.
They get tested, there's no UTI, but it's that ongoing irritation. And again, that's from menopausal symptoms.
Ah, okay. So you guys hear that? It is menopause and pelvic floor therapy. You know, they affect one another. So going through the stages, even perimenopause, you can have symptoms of
course,
of, you know, having pelvic floor dysfunction. So my next question to you would be, is leaking urine while sneezing, coughing, laughing, or even exercising normal?
It is not normal, but it's common. And our society, and we see it through commercials on TV.
Right.
How many times do they talk about poise pads? Or if you're exercising, just put a panty liner on, or buy the disposable underwear, or buy the reusable, you know, period panties, urine leakage underwear. So our society normalizes that, but what we should be doing, we should be empowering women to use what we have to integrate our muscles and be aware of any kind of internal lack of superior suspension that we could probably optimize better, so they don't have to use those items.
Right.
There's a big industry with that, but at the same time, it causes other problems. If you use a panty liner every day and you're changing it and several times, it gets itchy. It gets irritating.
Yeah.
And then who wants to have sex if you feel irritated? It changes our pH. It causes odors.
So what I was hearing, I was like, too bad we don't have any Nike shocks for the pelvic floor.
Oh, well.
That suspension system.
So
what size would you wear?
Well, there is a somewhat Nike shock. They call it a pessary.
Okay, okay.
So a pessary is like a brace for your pelvic floor muscles. So it would fit inside the vaginal vault, and you can have it where it supports the bladder. It kind of elongates and supports and lifts the rectum. And again, it helps support the uterus from dropping.
Okay.
So again, it's an external support. It's just like a brace. They work for women who want to just put one in. They want to exercise. They want to run, do an aerobics class. The able-bodied women that can take it out when they're done, they do well. Other women will use it, and they'll use it all day because they get the support. But what happens when you use a brace all day? The muscles get weak.
Yeah, the atrophy. Yeah, absolutely.
They get weak, and you can actually get like a callus-like sensation because it's firm and it's hard, right?
Yeah.
So can that kind of change things in the inside? It might.
Now, can you wear the pessary and have sex or no?
So the ones that we use in our clinic, pretty much you cannot.
Okay.
You know, because of where they're fitted. It's not like the old diaphragms where you can use it, you know, and it's protecting to have sex. It kind of is too close to the front, so you cannot. So now there are a lot of older women in their season years. They are not surgical candidates. The pessary is the only thing that helps them control their bladder symptoms or the sensation of something falling out.
Yeah.
They will wear their pessary for 30 to 45 days straight. They will use it. Some will use what they call, it looks like a knitting needle or crochet needle. They'll reach inside, grab it, wash it, and then if they can, insert it back in. Those are the good ones. Now, there's some women, they have to come to the clinic. They'll either see somebody like me or see a provider in women's health. We take it out, wash it in the sink, bring it back in, and they come and see us in 30 to 45 days.
I cannot imagine using a knitting needle in other areas.
No,
no way.
It's a pessary removal needle.
Yeah.
I will tell you, I did have one patient because the crochet needle was cheaper.
Oh, she
didn't. The Pessary removal needle.
Oh.
So she came in and she was still struggling, and she showed me her removal, and I was, that's a crochet needle. And she says, but it was only $3. And I was like, please don't use this anymore. So, so for that reason, it was, if we looked at the risks, it was not worth this patient to continue with her pessary. So we just told her not to use it anymore. And that would prevent her from using the crochet needle.
Oh, thank goodness. Okay. I bet she was looking for that needle everywhere. She was going to knit a blanket for her grandchild or something.
I'd rather her do that.
Right. I've had some friends that have been dealing with Rectocele. Could you explain what a Rectocele is?
So if we look at the woman's anatomy, like from the side, and we cut straight in half of them and turn the body to the side, the front part would be the bladder, the uterus and the vagina would be in the middle, the rectum would be in the back.
Mm-hmm.
So they're all kind of shaped like this, where they kind of go a little bit forward. Now, a rectocele is, if we look at this as the rectum and this is the opening towards the anus, a rectocele would be if the rectum comes out and then it passes the opening of the anus and it pushes in the back part of the vaginal vault.
Okay.
So if they are bearing down, like straining to poop,
right,
or coughing, this front part of the rectum will push in that backside of the vagina, and it can even bulge out. Now, when the poop fills in the rectum and it comes out, it will actually bypass the anus and it will go more forward. People will feel the stool at the opening, but it is not descending. Squatty Potty can help, because what it does, it'll tilt you and push you back, but sometimes it's not enough. Because if the poop stays in the rectum too long, it gets dehydrated.
Mm-hmm.
So if it's dehydrated, it's going to be a little bit hard. So people will strain. Straining is not good. It weakens that posterior part of the vagina. So what we tell women to do is a splinting technique. There's two kinds. The first is you wrap toilet paper around 4 fingers. As you are pooping, you are trying to poop, you push right behind the vagina, not in the vagina, right behind the vagina in front of the anus. As soon as you push up and bump, it can be enough to have the poop rediverted to go out of the anus.
Okay.
The best technique, though, dominant hand. So for me, it's my right thumb.
Okay.
It goes in the vagina. It supports that back wall. When I go in, if I have to poop, I will feel the stool on the other side. The minute I tap it, it will divert out of the anus without straining. It can be a game changer.
Okay.
Now, a lot of women
need to buy some latex gloves. Got it.
So you don't. If you wash your hands and you're clean, you don't.
And no fingernails.
Yes. No, well, some people have fingernails. Just use your pad. But what a lot of women ask is, do I have to always do it? No, because eventually the body will learn.
Yeah.
And you don't have to keep doing it. You'll learn when, I don't think I need to, because it's starting to come out. And then if it's really struggling and you're really having a hard time trying to eliminate, then you'll do it occasionally. But eventually, most women who start out that way, they gradually stop, because the body's smart.
Yeah.
The body will accommodate.
Do you know what I used to use when I was a kid? Oh my gosh. When I used to have issues with constipation as a kid, my grandmother, some of you probably have had your grandmother do this before. Maybe it was mine. I'm from West Virginia.
Castor oil.
Castor oil was one. And a little shaving, a little sliver of soap.
Oh.
I know, it was, but literally, but it worked.
So a better version of that, and if doctors will prescribe it, is Colace. Colace is like a sudsy material that'll work in our cheek check, and it gets it out.
Yeah.
It's usually a pill. So
it's a
red pill, so there's no bad aftertaste, but it'll get sudsy on the inside, but you don't have to taste it.
It was the ivory soap. I'll never forget it.
Wow. Maybe that's how Colace got started. That's pretty smart.
Oh, gosh.
That is
I'm glad she's not here anymore. God rest her soul to hear that. She'd be like, I told you. between the castor oil and the soap. Oh my goodness.
She should have come up with it with a patent, and she would have been pretty wealthy.
Yeah, I'm surprised she didn't put chewing tobacco. She chewed tobacco, guys. She put chewing tobacco on everything. So I thank God for the soap.
Oh my goodness.
Oh yeah, it's true. I got a bee sting one time, and she put some chewing. She spits the chewing tobacco out of her mouth, rubs it on my bee sting, and I'm like, oh, it's nasty. It's nasty. Sure enough, it stopped stinging, and the swelling went down. All for some chewing tobacco.
I know there's a reason why. There is a reason why, and I can't remember, but there is a reason why. I do know why that works. But there's a scientific reasoning.
Oh gosh,
that is so funny.
I'm so glad. So yes, I'm glad she used the soap instead of the tobacco juices. Oh my goodness. So we listed that you can have pelvic pain as a sign of pelvic floor dysfunction, urinating with any stress incontinence, laughing, sneezing, coughing. Are there any other symptoms that could be a sign of having pelvic floor dysfunction?
Oh, one that's really common is urinary urgency.
Oh,
you got to
did mention urgency, urgent incontinence earlier. Could you explain to us what that is?
Urinary urgency, quite a few women will have very strong pelvic floors, but it is the bladder that is overactive. The bladder is fasciculating. I gotta pee. And that fasciculation, as it's rocking and triggering your brain that you need to go very suddenly and it's intense, what do women do? They run to the restroom. So as the bladder's fasciculating and you're running, you're actually shaking it more. Your body's going to win. So women, as they are over the toilet and trying to dress and shake, some of them will pee on themselves before they even get over the toilet. So it is something where you've trained your body like Pavlov's dog, and it is a behavioral modification thing that you need to do. Some people will induce urgent incontinence because, one, they withhold water. So the minute the urine that is in their body is very acidic, so that's going to cause it to go, not just the filling of the bladder, but the more acidic it is. To life stressors.
Okay, so stress.
Yes.
Stress will kill anything. It's not good for us.
Yeah.
Not in the least.
So, and it's dietary too. If you add, people's happy places, they like wine, beer. Those are those are bladder irritants.
Yes,
right?
They are.
It's another stress reliever. When people are stressed, they eat sweet sugars.
True.
Those are bladder irritants. During the holidays, we like cheeses and dairy. Those are bladder irritants.
Anything but fruitcake. But we can see how those can be bladder irritants. Is it true that sometimes we don't fully empty our bladder? Is that also a symptom of pelvic floor dysfunction?
So the bladder is never completely empty.
Okay.
There is always a little bit of urine, but then we should be able to go around, and that should not be bothersome. It's never completely dry.
Okay.
But when you feel like you're not completely emptying, sometimes it is a structural change where the bladder. We talked about the cystocele, right?
Right.
But sometimes, a rectocele, there's a cystocele. So if the bladder is kind of caved in and going more, not only can it cause stress incontinence, but maybe that little bit that is in there becomes like stagnant water in a puddle, and it becomes more acidic. And so if you don't feel like you're emptying it completely, what you can do, we talked about the splinting technique, right? There's a Hula technique. So you take 4 fingers on top. You press on your pubic bone while you're on the toilet, and then you go up a few millimeters where it's soft. If you push in and down, you will feel the urge to pee.
True.
So after you're peeing, you do that Hula technique where you press, kind of stand up, squat a little bit, stand up, rock to the side, rock to the other side. You will feel more dribbling out.
Okay.
And if you're a little bit more empty than before, that stops you from like, oh, I peed, but I got to go back again. And it's only been 5 minutes.
Okay.
Yeah.
So stop that.
Yeah.
Earlier I wanted to address, you mentioned the Squatty Potty. For those of you who don't know what the Squatty Potty is, it's a poop stool, right? Yes. So go get your little stool from the store. Like she says, it'll line everything up so that the fecal matter can come right on out of there. Like I said, Dollar Tree, pop your foot up on that stool, puts you in that position you need to be in to kind of clear the passageway for poop to exit.
Yeah.
So I think every household should have a poop
Yes.
stool. You can buy it,
Mhm.
or I painted one once.
Oh, that makes
I was like,
it
I want a pretty blue one. Yeah.
Oh. So not only does it anatomically put in alignment, but it also, when your hips are past, when your knees are past your hips, it actually relaxes the muscles so that the rectum can release
Huh.
the poop too.
Go get your poop stool
today.
All right. So the next question I had to ask you is, what are some exercises we can do to strengthen our Kegel muscles?
So a lot of the things in the online and educational material, they talk about contracting the pelvic floor, but they're very not defined on how long do you do that contraction or hold, releasing, how long do you do that release and hold. I try to make it easy for patients. I talk about doing either an elevator or 3 levels.
Okay.
So if you're sitting or standing, you can call it an elevator. So you would actually have the head, shoulders, and hips aligned right on top of each other. The back is not touching anything. Legs are not crossed. You would squeeze your vaginal muscles a little more, all the way, 3 levels. Now going up is strengthening and also working coordination and muscle endurance, but coming down is lengthening, which can help relax and work on pain.
You guys hear that?
So then you're going to relax a little more, and then completely let go. That's 1. I tell people to do 5 in the morning seated.
Okay.
And then, remember, we call these elevators?
Right.
So if you're on your back, it's not really an elevator anymore.
Right.
So it's 3 levels, but it's the same concept. You would do it lying on your back on something firm, a floor, mat, carpet. Do not do it on a sofa or bed.
Something soft, yeah.
Yes. If your spine is curved and you do pelvic floor contractions, you give yourself tailbone pain and back pain.
Ooh, yeah. You say if you're hyperlordotic, we need to sit up, right? Or lay down.
So, yes. So just be your normal you. Everybody has a different kind of curvature in their spine. But we don't need to get picky by that. All you have to do is your head over your shoulders, over your pelvis. Don't look at thinking like a posterior pelvic tilt or overthinking. Just do what your body is telling you to do at this time. As you get stronger in your pelvic floor, as your core muscles get stronger, as your back and your hips start to stabilize, your posture will automatically change and improve. But you don't have to force it the first day.
Yeah. Okay.
Yeah.
All right. Going back to vaginal health, I know at one point you gave me some things, to tell other patients about helping with pH.
Yes.
Or even vaginal lubrication. Like what are some things you can tell our audience about that?
Oh, so probiotics, we all heard of prebiotics, right? So probiotics is very beneficial for vaginal health and vaginal pH.
Okay.
It's good for all women, but especially the seasoning, menopausal, perimenopausal women. But also another thing that can help is turmeric. Turmeric can help your vaginal pH.
Okay.
And then turmeric can also be good for bladder health, where it helps preventative of bacteria and inflammatory response. Initially, if you start taking like turmeric, your pee might smell a little funny, but usually between 2 to 3 weeks, that will go away.
Okay.
So if you are into oral sex, then the vaginal juices are a little bit more pleasant and a little bit more normalized. They aren't, as you get older and estrogen changes, they kind of deplete a little bit. Now, here's the caveat. If you are on hormone replacement therapy that has estrogen, turmeric is an estrogen blocker. So it might not necessarily be the thing for you. There's other stuff on the market that people can talk to their primary care.
Like estradiol or something like that.
Yes, that's not estrogen based or something that won't affect the turmeric, or the turmeric won't affect that. Another thing is D-Mannose. So D-Mannose is a simple sugar. Everybody heard of all these different bladder regimens that are preventative. Most of them will have D-Mannose because it takes away the biofilm in the bladder, which is like kind of the thin film that bacteria can hide under. So you flush cleaner. Sometimes when you pee, people will notice kind of a sweetening smell, but again, that goes away. But then people will feel like they pee cleaner, less irritation, and it is very helpful for those that get that urea-occurring UTIs or the sensation of UTIs.
Got it. So if someone was concerned about their pelvic floor health, at what point should they go see? I know you have to go to like your PCP first or your PCM. Definitely go to your doctor first. You can get an order. When should they go to the pelvic floor therapist? Like at what point, with all the symptoms they have, when should they go to the pelvic floor therapist?
When initially they are seeing regular incidences of any bladder issues. If it's a one-time thing, you know, sometimes we have a bad cold, or we laugh a little bit, and then maybe you leak a little bit, but then it's a one thing that happens maybe once every 6 months. Okay, maybe it's just incidental. But if they're having leakage that's 4 or 5 times a month, once a week, 2 or 3 times a day, then they shouldn't wait till it gets that long. When they start seeing symptoms more regularly, they should go. When they are struggling to poop, maybe they used to poop every day. Now they're pooping maybe every 2 to 3 days, and now they're straining. They should go and see their doctor, possibly be looked at for pelvic health issues. You know, and it may be in combination of other medical issues, but as an adjunct, we can help when they have pain. So anything having to do with the bladder, the bowels, sexual function, they should see a the physical therapist. And even if they just want the information.
I wish that pelvic floor was taught to us young, as you know, being younger, like in our teens, we're most active, because I did read some research on how like gymnasts and people that are teens that are powerlifting at a young age, they are already having leakage problems, and they may be 18, 19 years old, but they're thinking it's normal. So lifting heavy and stuff like that, and not being aware of, you know, contracting the pelvic floor can cause problems later on in life, right?
Absolutely. And it can potentially get worse because gravity is going to take over as we get older. Sure
does. More areas than one.
So if we notice it, ladies, with our boobs and our
That's
boobs
what I was just looking at.
Then we know and we see our boobs falling. If we see our boobs falling, then sometimes the organs in the pelvic floor are starting to lose their superior support. You may not necessarily have symptoms right away. Once you have symptoms, that superior support has already been compromised. I know when my daughter got her menstrual cycle, I talked to her about her pelvic floor.
Oh, really?
You know, just talked about, you know, never encouraging good bladder habits and good pooping habits. Don't wait. You feel the urge to go. Don't try to put it off, you know. The fun or the activity will be there. When she became an athlete, she got into competitive wrestling. I taught her how to use her pelvic floor for support. Because you're throwing people, you're lifting,
you hear that?
Straining.
Her daughter throws people, and they're about the same height, if not. Annalyn's probably a little shorter than her daughter, but that little woman can throw people.
I love it.
My goodness. And it's all because of the pelvic floor. Have a strong pelvic floor.
And her pelvic floor. And right now, my daughter is now a young officer in the Army.
Thank you for her service.
Oh, of course. She rucks. She's used to doing 12-mile rucks. She's used to running 8 miles, 8 miles, you know, on the weekends. She needs to engage her pelvic floor. That's right. If this is going to become a career, by the time she retires, she potentially could have problems if she doesn't start her due diligence now.
But it's not too late for some of us, right?
Absolutely.
No matter how old we are, we can be younger. If we're in our 50s or 60s, it's not too late to start strengthening your pelvic floor.
It is not too late. I have a patient currently, my oldest patient, she is 73.
Okay.
You know, and my youngest patient is 19.
Okay. Two more questions. The first one is, how can strong glutes or assets benefit the pelvic floor?
Well, so when we talk about glutes, let's talk specifically about the glute medius.
Mm-hmm.
And also another hip muscle is your obturator internus muscle.
In there.
So those are the posterior lateral portions of the hip.
Mm-hmm.
If they are strong and they are working efficiently, then the front part of our leg and our hip muscles don't have to work as hard. If you are overworking your quads and your hip flexors and your hip adductors, what happens is you can have more tension and tightness in the pelvic floor because it's strained,
Right.
and that could cause pelvic pain, or it could cause an inability to pee completely, or even affect bowels. So when you balance by using your glute medius and your obturator muscles, and the front doesn't have to work as hard, that it's almost like, remember, this is the front, this is the back, what's the bottom? The pelvic floor, it's the foundation.
Right.
If you have all the furniture on one side of the house, then that foundation's going to crack there.
Yeah.
You got to move the furniture around and balance it.
Yeah, balance it out. Feng shui
Yeah.
your pelvic floor.
Yeah.
Green, blue, yellow,
Yes.
purple, and a little bit of gold in the middle. No, I'm just kidding.
we have all kinds of muscles. It should be utilized. And sometimes as people, you know, it's hard for us to be aware of what to use. But that's why coming to see physical therapy, somebody like you, somebody like me, can help people have better quality of general movement.
Yeah, yeah. All right. So, lastly, before we go, what are 3 things you would like to leave with our audience today to help women understand the pelvic floor better, or to have, better all wellness, health wellness?
Wow. So 3 things is, whether you have pelvic floor symptoms or not, everybody should be conditioning their pelvic floor. We walk around all day, we're using our legs. We are using our arms to lift. When we are doing any of those general movements, we should be engaging our pelvic floor with.
Okay.
Yeah, I mean, my goodness, we should. And then we should also think about, how we take care of our mind as well, and sleeping well. If we're stressed and we don't have that mind wellfulness, that affects the pelvic floor. We get anxious. We will have urinary urgency and frequency. So that affects the pelvic floor. That raises our cortisol levels.
It does. And then one thing leads to another. If you're stressed or not getting enough sleep, what we do, we go after coffee. We go after all these things for it to have the caffeine. And again, that's acidic and can also cause pelvic floor problems, bladder issues.
Yes, and definitely bowel issues. A lot of people, when they're stressed, they get constipated.
Yeah.
Yeah.
I'm the opposite. When I get stressed, it's it's just like, get that out of here. My body wants to get rid of it. My brain doesn't want to let go. So I'm the complete opposite when I'm like stressed or nervous.
I think I'm jealous.
I mean, I don't want to back up everything. I don't have this backed up, this backed up. So my body's like, you know what? We're getting rid of this one way or another.
That's right.
And what is your final word for our guests today?
Oh, final word is, treat your pelvic floor with respect. Keep it strong, keep it conditioned, be aware of it. It is just not something that's kind of hanging out for the ride. We should be consciously supporting it and taking care of it, so it supports and it takes care of us. Right. We can be 120 and not have any issues with the pelvic floor if we start now, right? I think with how we're going, and with technology and knowledge and just eating better and medicine, we should be able to, right?
Yeah. Absolutely. Well, guys, that is it for today. Dr. Annalyn, thank you so much. I love working with this woman. She's amazing. She is amazing. I've learned a lot from her. She's so wise. Our patients love her. And I'm just so honored to work alongside you and help women, with their pelvic floor health. And she will be coming back with us, guys. We will have a show with her probably in the month of May, where we'll be talking about sexual health and pelvic floor. So I will keep you posted on that. Next month, we'll be talking about nutrition. And nutrition can also play a role in pelvic floor health and overall health. You are what you eat.
Absolutely.
So you guys take care.
And I just want to say, Kiki, thank you for doing this. I think putting this information out can touch a lot of women. Maybe they haven't seen the doctor right away, or they're uncertain of the symptoms that they have and they don't know what to do about it. So getting the word out like this, I think, is really key. So thank you for doing this.
Thank you. No problem. My heart is to help women. And, you know, I learned that we go through things in life. You know, I myself been through things, you've been through things, and we deal with stuff sometimes alone and by ourselves. And sometimes it is okay to sit down and talk with someone without judgment, you know, without regret, and just help someone out. Help your fellow sisters out. We're all in this together. We need to build each other up and not tear each other down.
Absolutely.
You know, you're unique. I'm unique. There's no need to be worried about what someone else is doing. You know, focus on yourself, pray for your brother and sister, and just know that we are all family. All right. God bless you guys.
Thank
you. See you next month.
Bye.
Bye.